Hi, I'm Dr. Castanet. Today I'm going to talk to you about the importance of your muscles in the low back with respect to back pain and chronic pain. Um, there's been a good deal of research over the years about the relationship between muscles and back pain, and we have done MRI scans since probably the early 80s in cross-section across the low back to look at the cross-sectional area of muscles. And we didn't pay a lot of attention to it initially, but in subsequent years it was noted that the muscle mass of the low back would atrophy and convert to fatty tissue in the presence of chronic pain for patients. We think this happens because when you have an episode of pain, you favor the region and you guard and you don't use the region, and over time, for somebody with chronic pain or intermittent bouts of pain in the back that come and go, that this results in eventual disuse atrophy of the muscles where they get smaller, and as they do that, the area is, they either convert to fatty tissue or fatty tissue infiltrates the region in the absence of the larger normal muscles. So as the muscles atrophy, fat infiltrates the region. I saw a recent seminar from Duke spine physicians that discussed this, and their solution was surgical, to place a little electrical apparatus in the low back and to place leads into the muscles that span the spine and are responsible for the intrinsic movements of the spine between different segments in the low back. This has largely to do with the low back, not so much in the neck. I don't know about disuse atrophy in the neck, but it's certainly present in the low back. It's often and usually an incidental finding in the low back because we're looking at discs and nerves and herniations and bulges and things like that. And so we often neglect the significance of the atrophy of the muscles in the low back. But if you divide patients into two groups, those with pain down the leg, which suggests a nerve impingement or pinching of the nerve, versus people that don't have that. The people that have pain down the leg related to a pinched nerve, they have to be treated a particular way until the pinching of the nerve is addressed. But in terms of chronic back pain, those people should be treated almost universally with a program to strengthen the back muscles. For the most part, that's paid lip service, I think, and we may not be advising or recommending, and when I say we, I mean physical therapists, chiropractors, and other physicians. We may not be aggressive enough in addressing the appropriate exercise to strengthen muscle and the appropriate protocol. I think sometimes we're not aggressive enough in providing demanding exercises for the low back, but I think most patients with chronic pain would be happy to do demanding exercises if it meant that it would resolve their low back pain or significantly improve it, and I think that is possible. What I liked about the presentation from the Duke physicians is that they recognize the problem and they have a solution for it, but it does strike me as a little odd that the solution is surgical when we think that volitional efforts on the part of the patient ought to be able to contract those muscles which have been atrophied, and to do this non-surgically, which of course avoids surgical risks as well as the expense. But I think then it also implies that we've been derelict about figuring out and strongly recommending appropriate back exercises to regenerate the muscles, to enlarge them, to make them stronger, to make them more effective in terms of their function, and hence to improve the low back pain status. What was also great about the study by the Duke physicians is that they demonstrated that for people that did this treatment and strengthened those muscles, that you can see improvement on the MRI scan and cross-section, so the muscles do get larger, they do get stronger, and pain is very much better, and the relief of pain increases and improves over years. So also they provided for research purposes a protocol that can guide us in our recommendations for the way of treatment. So now, based on that research, I would be recommending that you do exercise twice a day. They actually use the stimulator, electric stimulator, twice a day for 30 minutes at a time. That's a lot of exercise. I don't think that's necessary because typically volitional contraction of muscles is more effective in improving function and size and strength than passive means of contracting muscles. So I think that if you would do it, say a couple of sets to fatigue twice a day, and you do that indefinitely, that you will notice a significant difference. So I'm going to show you first some cross-sectional images of these muscles so that you understand what I'm speaking about. And I'll show you a comparison between normal, ideal muscles in the low back versus atrophied muscles in the low back. Then I'm going to show you a couple of exercises that I would recommend. Well, probably one that I would recommend. You can buy this apparatus on Amazon for probably $100, more or less. They're also available in commercial gyms, in most commercial gyms, and you can find them and do it that way. Although, given the fact that I'm recommending twice a day treatment for this, you're probably going to have to get the apparatus for your home, but it's pretty expensive. It's pretty inexpensive. It's easy to put together. It gives you immediate access. It makes it very easy to do. And these sessions, 2 sets, 1 set twice a day, I think, which is what I would recommend, takes probably 1 or 2 minutes each time. And I think the payoff is going to really make you happy. In fact, in my experience using this machine, I feel immediate pain relief and benefit right after I finish the exercise. So there's immediate payoff in the way of pain relief. And it's not too much to ask to provide something constructive in the way of helping with our backs when we spend all day long sitting and doing other things that are very demanding of our back and largely neglectful of doing the sort of care and preventive care for the low back that is reasonable given the demands we place on it. So I'm going to end this video now, and then I'm going to go to a short clip showing you the muscles and cross-section, and then I'll show you a clip of exercises to do for your own purposes. And I'll give you some links in this video below to find the apparatus on the Amazon website. Thanks very much. Bye-bye.